My name is Kristy Fogle. I'm an emergency medicine physician assistant, and I'm also founder of the Maryland Progressive Healthcare Coalition. I'm a resident of Baltimore County, and I've been practicing emergency medicine in and around the Baltimore region for the past 8 years. As a frontline healthcare provider, I speak on behalf of the patients insured by the private for-profit health insurance companies who many consider to be covered. As an ED provider, I see patients like this every single day. I've seen diabetics who come into the ER in crisis with blood sugars in the thousands because they were forced to ration their insulin. I've seen cancer patients who avoided their chemotherapy because they didn't want to bankrupt their family. From these patients, ED providers like myself frequently hear statements like, "How much is this going to cost? My insurance won't cover this. I can't afford this bill." I've had many of these patients get up and walk out of the emergency department against medical advice when I attempt to admit them to the hospital. In one such case, a patient with appendicitis who needed emergency surgery left because, and I quote, "I won't be able to afford this. I'll take my chances." As you can imagine, this is not what I went to school for. This is both frustrating and heartbreaking to witness as a healthcare provider who took an oath to care for my patients to the best of my clinical ability. I'd like to make this statement for the record. I don't care who you are. I don't care where you trained. It is impossible to practice to the best of your clinical ability in a for-profit health insurance driven system. Prior to the COVID-19 pandemic, 80 million people, or nearly half of all adults under 65, were uninsured or underinsured in this country. In Maryland, with the ACA fully expanded, that number equated to over 347,000 people still left uninsured. Due to the COVID-19 pandemic, over 27 million more individuals nationwide have lost their employer-sponsored health insurance. This committee must address the growing crisis that faces Maryland patients, which has worsened with the COVID-19 pandemic. Maryland patients need the General Assembly to step forward to ensure that they stop falling through the cracks of a broken for-profit healthcare system that has been complicated by multi-payer administrative costs and an emphasis on profit over patient care. HB470, if enacted, will take an important step towards providing universal coverage that Maryland patients desperately need by establishing a commission on universal health care, which would develop a plan for the state to establish a universal single-payer healthcare program. Marylanders deserve a universal single-payer system that focuses on their care without concern for middleman profiteering by the insurance industry, who, let's be clear, only goal is to maximize profits by denying care. On behalf of my patients and our community, I asked you to pass this measure with a favorable recommendation because Marylanders deserve the basic right of health care. Thank you for your consideration.